Services Committee meeting to order, February 15th, 2022 at 4:01 p.m. We'll start right away with Mr. Kevin McDonald, Office of the Aging.
Good afternoon, everyone. As you'll see, I don't have any resolutions this month. The only thing like I said, I have my monthly report, which I presented, and I'm here if anybody has any questions regarding that.
Supervisor Adams, a question for Kevin McDonald.
Yes, please. Kevin, could you give us an update on the hiring for the healthcare aides, the home aides?
Again, we've got two people in place right now, and we're in the process of putting in want ads in the paper for the other two part-time positions. I know that the list shows we have 3 people waiting. It's actually down to 1 right now. Okay, we just filled 2 of them last week. So we've only got 1 person on a waiting list. We're very pleased with that.
Supervisor Adams again. You're muted, Supervisor.
Could you tell us which 2 you filled?
We filled the Canaan and the Greenport one.
Commissioner Gibson, do you have a question for Mr. McDonald?
I did. Hi, Kevin. When you say 1 person on the list, Kevin, is that throughout the county or just in those towns?
No, throughout the county.
Okay. And I forget, what's the eligibility criteria on that?
For what, an aid?
Yeah.
To get an aid? They have to be lacking in two or more areas of, daily living type things. Like I said, the majority of them are these people. They're getting Meals on Wheels is one of the services they get. But they may need assistance with either grocery shopping, light housekeeping, laundry, cooking, and some of them do require level 1 services, which could include bathing and grooming.
Okay, very well. Yeah, I'll reach out to you. There's someone on your Meals on Wheels route that I'm concerned about now. I'm going to open an adult protective case.
Okay.
But I think there's at least a need for some assistance there, and I'm not sure how much. So I'll reach out to you on that. Okay.
No problem. Yep.
Thanks so much.
Supervisor Adams?
So Kevin, I have one more question. Didn't we plan to do some outreach to advertise this program so that more seniors are aware of it?
Yes, it is. We put it on our on Facebook, on our Facebook page. I'm just trying. It's been in our newsletter, our monthly newsletter about the program, and one way to look at it is a lot of this usually spreads by word of mouth. That's the quickest way for it to get out there, and we are getting more calls. We're getting more calls looking for services now that they know that we can fill some of these requests.
Excellent, thank you. Any further questions for Mr. McDonald? All right, then Mr. Gibson, while you're on a hot mic, I'll turn it over to Commissioner Bob Gibson, Department of Social Services.
Thank you, Supervisor. I appreciate that. So much like Kevin, I didn't bring any requests for resolutions this month, but I did want to update the committee on something that perhaps some supervisors are aware and some are not, that I've been attempting to do. But for a couple of years now, I've wanted to house Code Blue, what we call or what are referred to as Code Blue clients. And those are clients between the months of late October and early May that, although they may not otherwise be eligible for any services for one reason or another, there's a no questions asked policy on housing them because of the cold weather. And typically that housing gets done the same way the other housing gets done, which is to say, we put the individuals in hotel rooms, and we just continue that. Some folks use it the entirety of the winter. It's just as needed. But I'd started looking into a couple of years ago the possibility of a warming center, which would be going through all of the night, and people could come and go. There would be food there. There would be hot drink available. There'd certainly be cots, so folks could sleep if they wanted to, but they also could feel free to come and go. And the reason for that being a revelation, as some of you might know, is that there's some people who won't even come in for help during code blue season. They just, they, for any number of reasons, but not the least of which is they really don't want to be sent to a hotel room out in Canaan, or a hotel room, in Chatham, or perhaps, even further out of the way. And so they opt not to come in at all. And, many of them are then seen around either Greenport or the city of Hudson. And, we'll get an on-call from either the sheriff, an on-call notice from either the sheriff or the HPD. So, we have this person, they were at the park and it's really cold, and we'll ultimately end up, arranging for a cab if we can, or somehow getting them to a room. But the long and short is, if there were something very close by where they knew they could come in and go as they please, and it's a safe place, and it's there every night of the week, they would do so. And I have the budget to do that. I've cleared that with the state. I went a few steps further this year, and the folks over at the Green Street Church agreed that we could use their community space in their kitchen overnight every night. And I got agreement from the Mental Health Association that, they would sort of come in late in the day, late in the afternoon, and be willing to provide some transportation, and also use of their community room until the community room at the church became free. So I was very excited to get that going, and I tried to enlist St. Catherine's to help staff this overnight warming center. They could not do it themselves, so then we tried to go through the agency that they use to do staffing, and even with raising the rate quite generously pursuant to our budget, we have not been able to staff that. So I have the budget, and I have a place set aside at Green Street whereby we could actually operate a warming center, and I'm not able to do that now because I can't staff it. So I wanted the supervisors to know that, and that I'm going to continue to try to staff that, because that is definitely the model that I want to go into. It definitely attracts more people, and it brings people more into the system more readily, because they can do it at their pace. They can do it with no strings attached, and again, it tends to foster community relations, and relations among the different clients. So I'm at a point where I am really trying to find staff for that. I don't think we can solve that on this call, but I just want that out there. And I'll take any questions. It looks like Supervisor Adams may have one.
I do, and I think this is a wonderful idea, and would love to see it executed sooner rather than later. Do you know how much staff you're looking for, and whether they have to have, do they need to be skilled, or could they be community volunteers?
Well, the other thought is to turn this over to volunteerism. Essentially, you just need a responsible person that can do the intake, which is as simple as, yes, welcome, come on in. And here's what we have available. Are you hungry? Do you need this? And someone who could readily get help from wherever they may need it if something were to come up. It's one of those things where you can't just open a warming center and keep it open because somebody, may have a medical emergency while they're there. You just never know. So, no, I think we could probably look to do this through volunteerism, but I guess we would have to organize under those principles. And I certainly wanted to try to do that under the hiring scheme because, I was hoping to get people who had worked at overnight shelters themselves.
So
But I'm open to that.
I was just going to say to follow up, 25 years ago when I lived in the city, our church did that. There was a skilled person there, but we provided two volunteers to every skilled person that was there. And that's how it was worked out. And then there were 4 churches in the area and each church took a night. So then the full week was taken care of or something. So I'd be happy to talk to you about that if you want to talk about it further.
Yeah, I would, and I'd like to put a small subcommittee together, just over here at my office, with folks who have an ability to outreach like that, because the church is willing to give the facilities over every night. So it would really be a matter of staffing.
All right, Supervisor Cousin.
Yeah, I'd like to join that subcommittee. Also, I could see it being very beneficial to partner with some grassroots organizations. I know that the Mental Health Association provides training sometimes around like mental health first aid. I think Narcan training, like those types of skills would be good for paid staff. I think volunteer run would be great, but there should be some paid staff because that is emotionally tedious work. But also through the housing coalition that I work for, we had some ideas around this issue also that I'd like to share with you. So when you decide to put that subcommittee together, I'd like to be a part of that.
All
Thanks
good
very
points,
much,
Supervisor.
and you will be indeed.
Thank you.
Supervisor Mia. You're muted, Supervisor.
I have another question. One of the homeless guy, his name is Joral Parking. He live in Jocelyn Motel, but he like to be in a home, like the apartment. He don't like to be in the motel, hotel, and I think so. DSS take care him the Jocelyn Motel. How we can help him?
So he's at the moment, whoever that individual is, and if he's being housed there, then he is part of a program where we're trying to move him towards permanent housing. And quite frankly, one of the issues that we might be facing is a shortage of permanent housing or being able to match this individual with housing. But I would suggest if you could, Supervisor, just to keep the individual's confidentiality, if you would like to give me a call tomorrow, we can talk very specific about that individual, and I'll tell you right where we are in that process.
Okay, thank you. I'll be call you. Okay.
Thank you.
All right, thank you both. Chairman Morrell.
Yes, thank you. My question was along the lines of Supervisor Cousin in terms of agencies that might be out there. Maybe it's one of our, rather than hiring someone, Commissioner, maybe we contract out for the service if we have the funds available.
Oh, I'm sorry if I didn't make that clear. I was not hiring in-house to do that. In fact, I was looking to contract for those services. First with St. Catherine's, who not only do I contract here for home finding, but they run the Marillac shelter up in Albany. So I thought that they may be able to provide a couple of staff. Yeah, that's just not something that, I could staff here at DSS. Not at all. MHA is involved in the process. They are not able to staff the overnight portion of it, but they are able to provide certain staff between mid-afternoon, late afternoon, and in the morning. And we're willing to give over the Apogee Center community room between the hours of like 4 and 8 o'clock, and then transport over to the church at Green Street. So yeah, ongoing discussions, and it's great. The folks who have indicated a willingness on this call to be a part of that committee, that will be set up forthwith to see if maybe we can't staff it with volunteers.
Thank you.
Okay, are there any further questions for Commissioner Gibson? All right, thank you very much, Commissioner Gibson. We appreciate it.
Thank you, Chairman.
All right, now we're going to go into Jack Madden, Department of Health.
Okay. We got first resolution here. Yeah, so we received a COVID vaccine response grant in 2021. It was mostly geared toward paying for staff time, and as things dwindled down and we got the contract nurses in, we didn't use as much as we thought we would. So we want to transfer. The state has given us the green light to transfer the money over to 2022. So this is just to move that money over to our current budget.
I'll move it.
Seconded.
Discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
All right, so I apologize 1,000 times over for this resolution coming in late. We had a discussion yesterday morning at a meeting in regard to this. As some of you know, the health department oversees the Healing Community Study, which is out of Columbia University. We are in, I believe, year 3, which is the last year that we have community impact dollars available to us. We had spent a lot of money. We had set aside $118,598 to support a program at Twin Counties that we thought was going to be defunded this past year, and it wasn't. Oasis came through with the funding for it. So we had this money left over, and then we began having conversations about medically assisted treatment at the jail. This is a high priority for the grant for Columbia University and for NIDA, which actually is the ultimate funder, to have medically assisted treatments in the jail. The previous sheriff was in favor of it, but his medical director wasn't. He kind of put up some roadblocks. The current sheriff is in favor of it, it's just, and I think it will happen. It's just the problem we have is a gun to our head. The grant year ends March 31st. We have to have all of the funds expended by March 31st, or we lose them. So this is transferring the $118,598 of Twin County Recovery Services, hopefully to support medically assisted treatment at the jail and or other similar services if we can't pull that together. I'm still very hopeful that we will be able to do that. Dan, you got any comments on this?
No, thanks, Jack, for asking. I think you summarized it really well. It's just a matter of timing. The money has to be allocated by March 31st, as Jack said, and we've inquired with the HCS people as to how hard of a deadline that is. And we're being told that it's a relatively hard deadline. So, we don't want to lose this opportunity to receive these dollars and to allocate them in a way that they'll be meaningful to Columbia County. So, again, apologize for the lateness of this resolution, but like Jack said, the meeting literally happened yesterday, and we scrambled and we wanted to get this in front of the home committee so that we could just continue to move it along before the deadline of the 31st.
All right, do I have a motion?
I'll make that motion.
Do I have a second?
I'll second.
Any further discussion? All in favor?
Aye.
Opposed? Carried.
Thank you. Thank you very much. So the director's report is in front of you. I'll answer any questions that you may have seen in the paper about the PFOS found in the water supply at the New Lebanon High School and Valatia Village Water Supply. It's something that was discovered in the last quarter of 2021.
And both the mitigation, well, you can either drill a new well or you can put filtration on the system. Drilling a new well doesn't work if you don't know what the source of the contaminant is. You could just drill a new well and end up hitting the same pocket in the aquifer. So both Village of Alacia as well as the high school and New Lebanon are going to install filtration systems. The exceedance is very minimal above the state. The feds have a 70 parts per trillion MCL maximum contaminant level on this. The state went ahead and set the parts per trillion at 10. So it's just barely over the line with this. If you continue to drink it, it wouldn't necessarily have any health effects. The Village of Alacia has shut down the water supply. They have 4 wells. They're working off of well 2 and well 4. This is well 1 that had to hit. And New Lebanon is providing drinking water and shutting down their water faucets. They can use the water for cleaning in the kitchen. They can't use it to cook, so they're also using bottled water for that purpose. So it seems to be, and a reasonable question would be, what's the source? We don't know. We don't know what the source is at this point in time. The state's probably going to do some sampling around it. I know they did that up in Clifton Park. They did some private wells around the school up there, and hopefully we may learn better what's going on under the ground. The only other thing on the report I would point out is that as a result of crazy month of January, we had 3,006 COVID cases. We topped 10,000 cases overall for this past year. And actually, we're at 10,400 or something. And the good news is that we had 20 cases this morning, which is really flattening out. It's really flattening out very, very quickly. So that's all good news.
Supervisor Helsley, you had a question for Jack?
Yeah, I was just wondering, with the PFAS contamination, is there any plans to do any testing on area, residential wells or anything like that in the area?
Yeah, so as I mentioned, the state DEC did some testing on the wells around the contaminant at the school up there. It seems reasonable that they would come in and do some testing as well, or at a minimum, make some grant money available to people to get it done. We've posed that question to the state, and they promised to get back to us in terms of what might be available.
Thank you.
Supervisor Adams.
Thanks, Jack. I read your report and was reading through the vaccinations that were given recently. I just wondered if it's there. I didn't see it. Do we have a percentage of people that have had booster shots? Because I did hear nationally that number is hovering somewhere around 35, 38%. And I'm just wondering how we as a county compare to that number.
Well, the last time I looked, as some of you know, I was a victim this past week of COVID myself. I spent a good deal of time in my bed at home sleeping. But I think last Tuesday, before I went out, I was looking at the CDC site, and I think among senior citizens over 65, I think we're at 63%, something like 63%. Among individuals younger than 65, we're not doing as well, but I think the lowest number is like 51% from the 18 and above. So we're doing better than the national average. We always have in terms of our numbers here. I'm disappointed, and in terms of the numbers, especially among the seniors, I really thought that they would turn out. But now we do have a pod, a clinic at the college every Thursday from 3 to 6. Their numbers have dwindled considerably. You can see it in the report. The first week of January, we did over 400. The second week of January, we did 200. It just kept dropping. And so we decided to keep it open and keep it there so people knew it was. If they want to come, they can get a first shot if they want. They can get a booster shot if they want. This past week, and I think the last 2 we had been running in the 20s. This past week, we did 46. And the nurses that were over there tell me it was mostly healthcare workers, which are supposed to get the booster before the 21st of February. Also some students who also had to get boosted before he went back to college. So I'm hoping to see that trend continue. I'm hoping that we can continue to vaccinate, and we'll stay there as long as we get some people showing up.
Any further questions for Mr. Mab on his reports?
All right, so this is a conference objective form. I know we've changed the practice, so I'm a little confused. I guess this got to the controller's office at a point in time when there was nobody in the controller's office, so I think we missed the early bird.
No, Jack, this was because it's out of state.
Oh, okay.
All conferences out of state need to be referred to committee for approval.
So Columbia County is one of 24 counties in the state to receive an OD2A grant, which deals with the opioid issues in the county. This past year was $77,000. It's not a huge grant, but $77,000. It kind of collided the last couple of years with the Healing Community Study grant, which has this ginormous amount of money to spend in the community. And so we ended up having a difficult time spending this money over the last 2 years. That will change completely this coming year because we won't have any impact dollars out of the Healing Community Study. So this is the, if you will, the conference for people who are working in with the opioid issue. The folks up at the State Health Department have encouraged the two people that do our grant to go to this conference. I guess there's going to be others from other counties here, and also the State Health Department itself is going to go to this conference. I do think that we're easily going to continue to get this opioid money, and it'll become more critical in the coming years as we no longer have the Healing Community Study.
Okay, I guess we do this by motion, Kelly.
Yes, sir.
I'll
All
move
right, do I
it.
have a motion to support Department of Health of the Columbia County and the Drug Abuse and Heroin Summit?
I'll move it, Morel.
I'll second it, Eldridge.
Discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Thank you. And that's what I have.
Magnificent. Any further questions for Mr. Mab? Okay, thank you so much, Jack.
Thank you.
We will move on to Director Almasi, Human Services.
Thank you. Good afternoon, everybody. Just a couple of resolutions today. The first one that you're looking at has to do with backfilling a budgeted vacant position for one of our clinical positions, the behavioral healthcare social worker position. We had a resignation recently, so we're asking for your support and permission to seek a replacement candidate for this vacancy.
Move it, Morel.
Second, Ligonia.
Discussion? All in favor? Aye.
Aye.
Opposed? Carried.
Okay, thank you. Just as a side note on that resolution, I am optimistic. We do have a candidate scheduled for an interview in, I believe, early March. She had to reschedule. We were going to have it earlier this week, but it's looking promising. So I'm very hopeful that we'll be able to, bring ourselves back to the same place that we were prior to the resignation. Okay, so this next resolution that you're looking at is also due to a resignation, but of a nurse practitioner. So again, similarly to the previous resolution, I'm just asking for your support to backfill this vacant budgeted position for a nurse practitioner.
Do I have a motion?
Morel.
Do I have a second?
Elsley.
Discussion? All in favor?
Aye.
Aye.
Opposed? Carried.
Thank you. So this resolution has to do with the nurse practitioner that I just spoke about, who has resigned. In an attempt to help us transition and onboard the newly identified nurse practitioner that's going to be taking her place, we feel it would be beneficial to contract with her for 1 day a week so that she can assist in the onboarding process, the transition of her caseload, which is near 200 cases, to the new incoming nurse practitioner. So I ask for your support and permission to contract with her for a period of time. I believe it's 6 months.
Do I have a motion?
I'll make that
I'll move
motion.
it. Do I have a second?
I'll second it, Morel.
Discussion? All in favor?
Aye.
Aye.
Opposed?
I-
Did you have
So-
something to say, Director Almasi?
I do. Thank you, Chairman Collins. So what I would ask is, because time is of the essence, I'm not sure what would be necessary. I think it's similar to what we did last month, where I wanted to maintain the, excuse me. I wanted to maintain the continuity of being able to have Jacqueline Christie on board. Her scheduled last day is the 25th of this month. So in order to, move seamlessly from her last day into the consulting role at 1 day a week, I think we'd have to figure out a way to accelerate the approval process in terms of reviewing her contract with the county attorney and such. I know we did this last month with regard to Kathy Darling's retirement as a nurse practitioner, and her staying on 2 days a week to help us with the need that we have around prescribing hours. So I'd just like to ask if something of that sort could be done in this case as well.
If you could, get a copy of a contract or some form of a contract to the county attorney, and we can have a discussion as soon as tomorrow with the county attorney about it.
That's great. Thank you, Chairman Morel. I appreciate that. I believe, Kelly, we submitted a draft of the contract in our package to Kelly. Do you have that, Kelly, or should I send it?
You should send it with your normal contract review form over to Rita, the
Okay,
county
cool.
attorney's office,
Will do.
with with a note on it for the urgency.
Okay, thank you very much. I'll do that. And then I think there's one more resolution.
Yes, this is it.
Okay. Right. So this is just our request to contract or to update a contract that we previously had with a recruiter known as Locum Tenens. This is so that should we have vacancies in terms of prescribers, we can just seamlessly partner with them and try to find candidates, identify candidates. It's looking as though we have some candidates. I just want to express my gratitude to the county and specifically Human Resources for working with our department. They've implemented a new practice where they're assisting departments in filling their vacancies. That's proven very helpful to us here at the Department of Human Services. So I would prefer to find candidates for any vacancy through job postings and such, as opposed to going through a recruiter, because going through a recruiter comes at such a cost. The finder's fees can be up and around $20,000 themselves. Plus you're paying a premium hourly rate for that individual. So whenever we can avoid it, I prefer to do so, but I'd also like to have it as an option to work with the recruiters if I have to.
Okay, do we have a motion on this resolution?
Helsley.
Second?
Morel.
Further discussion? All in favor?
Aye.
Opposed? Carried.
And so we have the overtime report here. $12,000 is what we budgeted. We spent a whopping $96.55, leaving us with a balance of $11,903.45.
Okay, do we have any further questions for Dan Almasi, Director Almasi?
Dan, you had one other discussion regarding BMA, or was that left on there from last month?
Right. So I believe last month I brought it up and solidified your support as a committee for me to move in the direction of, phasing ourselves out of the Valatia Medical Arts Center. I am in the process of bringing the staff back to Hudson. The one staff person that was seeing clients face to face is trying to tidy that up and either work with the clients to get them to come to Hudson for clinical services or to discontinue the clinical care if they're ready to do so. So that's happening. I also reached out to the landlords and made them aware of the decision. And they said they would get back to me in terms of whether or not they had someone that was interested in the suite or not. I haven't heard from them. I should probably reach out to them again and see where they're at, just so that we know where we stand, if we'll be able to opt out earlier than our lease expiration date, which is September of this year. I'd like to avoid having to go full term and pay for the space. That would be ideal if we could get out of it early. But one way or another, we'll be done in September.
All right, any questions? Thank you very much, Director Almasi. Does anyone have any questions for Mr. McDonald, Mr. Mad, Mr. Almasi, Mr. Gibson? Okay, Kelly, has there been any public input?
I have no emails from the public.
Well, if there's nothing further, then I'll ask for a motion to conclude this meeting.
So moved.
I'll second. All in favor?
Aye.
Aye.
Aye, have a good afternoon, everyone.
You as well. Thanks.
Bye, everybody.
Bye, everyone.
Thank you.